Okay, we'll look at Chapter 13, the heart. What are we going to do? We'll look at some of the functions and the components of the circular system, talk about the structure of the heart and the function of the heart. So the function of the circulatory system, its function is to circulate blood to all parts of the body using arteries, veins, and capillaries. Now the blood carries oxygen and nutrients to the cells and carries away the waste products. Now the lymph system will return excess fluid back into circulation, and we will have a separate chapter dealing with just the lymph system in about 3 to 4 weeks. So there are actually two different circuits that blood can go through. Starting right here, you will have the circuit where the blood goes from the body to the heart. Then you have going from the heart to the lungs and back to the heart. Then going from the heart to the body and then circling around and coming back to the heart again. And they're referred to as the cardiopulmonary circulation. That's when it's going from the heart to the lungs, or the general or systemic circulation. That's where it's going from the heart to the body and back to the heart again. Now, depending upon which circulation route you're in, the components of the blood will be different. And if it's helpful, think about the circulatory system as like UPS. You know, the UPS guy that delivers Amazon packages to you. Okay, the circulatory system is kind of like UPS. The blood is that UPS truck. Now the heart is the gas that makes that UPS truck go. Now as that truck, the circulatory system, arrives at different points within your body, some things will be offloaded and some things will be picked up. Now strange but true, there isn't a UPS guy to make sure that that happens. It operates completely on concentration gradients. So, if the blood has a high concentration of oxygen and the tissues around it, the muscles in your body, have a low concentration of oxygen, oxygen will flow from the bloodstream using simple diffusion into those muscle cells. And the reverse is true. If those muscle cells have a higher concentration of carbon dioxide than is in the blood that's surrounding it, the carbon dioxide will go down that concentration gradient and enter the bloodstream. The heart itself is about the size of your fist and weighs about 1 pound. It's located just underneath your sternum, but it is kind of tipped sideways. So even though it's centrally located, the point is off to this direction right here. So it makes it seem like it's more on our left side, but it is really centrally located. Now, stethoscopes. This is something that always made me a little bit curious, because I see the doctor when I go into the doctor's office, and there are two sides to it. And I'm like, well, do you know what to use it for? Well, if you look closely at a stethoscope, the two different sides are shaped differently. They have a diaphragm side. This is the larger side that is flat, and it acts just like a diaphragm or a speaker. Okay, and it is more sensitive to medium and high pitched frequencies, where the bell side, what they call the bell side, it looks slightly concave, that is shaped to be able to collect lower pitched frequencies better. The structure of the heart, it is hollow and it is essentially muscular, but it does have different layers. If we start on the outside layer, that is the pericardium, and basically that's just a tissue sac for it to be housed in. Now between the pericardium and the epicardium, the exterior surface of the heart itself, there is fluid, and that exists purely to lessen friction as the heart moves while it pumps. So the epicardium is the surface of the heart itself. Then you also have the myocardium, and that is the muscle tissue that is the bulk of the heart. And then on the inside of the heart, of those hollow cavities within, you have endocardium. endo meaning in, myo meaning muscle, epi meaning outside or surface. So those are some hints to help you remember what some of those are. Now, if we were able to cut a heart in half, what you would see is right here on the right side, you have two veins coming into the heart. Those are the superior, meaning on top, and inferior vena cava. Those return all of the venous blood to the heart. That enters the right atrium. It's kind of like a little holding cell. Okay, it then goes through the tricuspid valve into the right ventricle. From the right ventricle, it exits to go to the pulmonary artery. Strange but true. All the other arteries in the body will be carrying oxygenated blood. However, the pulmonary artery does not, because it's in that alternate route that's going from the heart to the lungs and back to the heart again. So after that blood goes to the lungs, it comes back to the heart, to the left atrium, where it will go through another series of valves to the left ventricle, then exiting to the aorta. And I have a better picture right here. Yeah, although this is back to the surface again. Yeah, I have the better picture. It's coming up next. This is just to show you that on the surface of the heart, you actually have blood vessels feeding the heart itself. And if an individual has a heart attack, what it is one of these blood vessels becomes clogged. And if the heart itself is not receiving oxygen and nutrients, the tissue that it is feeding will die. And that's what happens in a heart attack. Here's the inside with those different parts labeled. Right atrium, the tricuspid valve right here, the right ventricle, the pulmonary or semilunar valve, and that's the one that goes out to the lungs. Returning, you have the mitral valve. And there is a condition known as mitral stenosis. And stenosis means hardening. And some individuals can have these valves become hard so that they don't close all the way. And when that condition happens, when the heart beats, you can get blood getting pushed back against the flow. This can cause some problems with fluid buildup in the lungs. Separated into right and left halves, there's a septum. Oops, right here. The septum is differentiates or separates the right and left ventricles. It's also important in the conducting system of the heart so that it will beat. Okay, this just shows the blood, which direction it's flowing. Okay, the atrioventricular valves, that's the tricuspid and bicuspid valves. Those separate the atria from the ventricles, and then the semilunar valves. Those are the ones from the ventricles to the arteries leaving the heart. We kind of talked about that already. Heart rate. Normal heart rate is somewhere between 72 and 80 beats per minute resting. When someone is actually exercising, working hard, it can be anywhere from like 140 to 160 beats per minute. But when they're calculating cardiac output, what they do is they look at the stroke volume, how much blood is actually moved by each beat, and then multiply that by the heart rate. So if someone's stroke volume is 60 milliliters, what is the total cardiac output? Yep, all you have to do is crunch the numbers. So, heart sounds. If you were to take one of those stethoscopes, strange but true, when people say lub-dub, that's really, really what it sounds. And that first sound, the lub, that's the tricuspid and the bicuspid valves opening and closing. So those are the upper ones. The DUP is the aortic and pulmonary valves, opening and closing. Okay. Conduction system. The heart has to have some type of mechanism to keep it working, to make those fibers contract, just like we learned back in the muscular system. These are electrical signals, and if you've heard of somebody who's had to have like a pacemaker put in, that's because their electrical system is just not working quite right. It all starts with the sinoatrial node. Notice that it's in the upper right of the right atrium. It will send a signal to have this, the right atrium contract, and you have that signal going over here to the left atrium also, so they will simultaneously contract. Then you have the atrioventricular node, and you'll notice there's kind of this gap here, the node, and there's some actual fibers there that inhibit the flow of that electrical signal. And the outcome of that is there's that gap in time between when the atria contracts and when the ventricles contract. And we like that happening because that gives time for the blood to flow from the atrium into the ventricle. If they happen simultaneously, then you just have blood squirting everywhere. Anyway, that part of that electrical system is these Purkinje fibers, and they are the fibers that go down the septum and then around the walls of the heart. And because of how they are contract, you get the contraction starting in the apex of the heart and then squishing up towards the top, so it completely contracts the whole heart. So these electrical system signals can be sensed by sensors put on the body. And you can see here somebody getting ready to have an EKG done of them. Notice all of those leads. They're there for a reason. But what you need to know is when you look at those leads, their output, you're going to get this kind of a shape, and it helps the individual. And each part of this shape is labeled something, and it denotes something. This first little blip right here is when the atrium depolarize. That means they are, contracting. Then you get this huge spike as the ventricles depolarize. Over here you get the T wave when the ventricles repolarize, and you'll notice there, nowhere in there do you see the atria repolarize. It does happen, but it's happening while the ventricles depolarize, and so it's really, really hard to differentiate that. It's kind of hidden. You can see here the different leads. Remember that individual had like 5 or 6 on their body. The signals will be just a little bit different depending upon exactly which placement it is, but they all have a similar shape in one way or another. And here is just a little bit of something to make you smile. If you have to look at it for a sec to get the joke, that is just okay. If you have any questions, you can always send me an email.